Hello, everyone. Thank you so much for joining us today. My name is Elizabeth Mandel. I am the CBHC MCI manager with MBHP, and today I have my co-facilitator, Shelby.
Thank you, Elizabeth. My name is Shelby Gately. I'm the program coordinator for MCPAP ASD-ID, and more often than not, when you call in for a consult, you'll be speaking with me.
And we are going to be providing an introduction to MCPAP for ASD-ID for CBHCs, MCI, and emergency department clinicians. The outline for this training, we're providing an overview of MCPAP for ASD-ID supports and services, the types of consultations MCPAP for ASD-ID offers, how and when to utilize MCPAP for ASD-ID, and what to expect when a MCPAP for ASD-ID consultation happens.
How MCPAP for ASD-ID can help. MCPAP for ASD-ID provides diversionary intervention and/or clinical support for youth with ASD-ID or suspected ASD-ID, whether they're in the community, in an emergency department, or boarding for acute care at home or in the ED.
An overview of MCPAP for ASD-ID. MCPAP for ASD-ID offers supports to CBHC, MCI, and ED clinicians and teams working with youth and young adults up to the age of 26 years old with an ASD or ID diagnosis. The service is free and insurance blind. It's staffed by a program coordinator, a team of board-certified behavior analysts, and a team of physicians with ASD expertise. The BCBA services are available Monday through Saturday, 11 a.m. to 7 p.m., excluding holidays. The physician team is available Monday through Friday, 1 p.m. to 5 p.m., excluding holidays, to consult on prescribing or medical issues. Consultations may be done by phone with the crisis clinician or by telehealth with family and/or the crisis clinician as appropriate. An important tenet of our program is to respond to requests for consultations as rapidly as possible.
Some examples of how MCPAP for ASD-ID can help. If a youth is struggling or in crisis, a BCBA can help problem solve and create interventions to minimize safety or risk concerns and unsafe behaviors. If a youth is boarding, a BCBA can help develop a short-term behavioral plan to help mitigate risk. A MCPAP for ASD-ID physician can address medical issues that might be related to the youth's crisis. For example, medication, sleep problems, or other physical issues. They provide suggestions and/or recommendations to additional treatment modalities, working collaboratively with the family and the ongoing prescriber.
For a youth that is boarding, MCPAP for ASD-ID is available throughout the time the youth is boarding, at home, or in the ED. The MCPAP for ASD-ID team can offer suggestions on how the environment can be managed to improve the youth's behavior while boarding. They can explore opportunities to stabilize and/or potentially divert the youth from the ED and/or integrate interventions to further promote stabilization in their home environment. They provide suggestions on how to support the youth if they are transitioning to a new placement, such as a YCCS, ICBAT, or CBAT, or an acute level of care.
The initial consultation is with a BCBA to focus on presenting behaviors. If the crisis clinician has seen the youth directly, the BCBA can do a phone consult with the crisis clinician. If the clinician has not seen the youth, it is highly recommended that the family is included in the initial consultation. If there are unresolved issues after the initial consultation, a telehealth visit with the BCBA and family can be scheduled. If there are medication or medical issues, a MCPAP for ASD-ID physician is available for a phone consult or a telehealth visit. Very important to please note, that if a consult, whether it be over the phone or telehealth, with a MCPAP for ASD-ID physician is needed, and the youth or family are directly involved, this type of visit must go through the registration and scheduling process similar to any other hospital visit. This takes longer to schedule due to the extra steps involved, including ensuring that the family has internet and technology to participate. Please keep in mind scheduling this type of visit could take up to 24 hours.
How to reach MCPAP for ASD-ID? You can call 866-ASD-ID-99 or 866-273-4399.
What will happen when you call? When you call, please state that you're calling for a MCPAP ASD-ID consult. From Monday through Friday, 11 a.m. to 7 p.m., a MCPAP ASD-ID program coordinator will answer your call. On Saturdays, the BCBA will answer your call directly. Information that will be requested. We'd like the name of the CBHC, MCI, or ED provider calling, the crisis clinician's full name and their cell phone number, the clinician administrator or supervisor's information to call if the crisis clinician is not available. We'll need the youth's name, their gender, their date of birth, race and ethnicity, the town that they live in, and the insurance that they hold. We'd like to know the date and time that the BCBA consultant should call to speak with the crisis clinician if the crisis clinician calling is not available for a response at that time.
Information to have on hand when calling for a consultation. The BCBA will need this information to provide a recommendation. The precipitants of the current crisis. The youth's current developmental or functioning level. Past and current behavioral health and psychopharmacological history. Current safety risk factors and our current concerns. Any safety plans already in place and ideas about why it hasn't worked. The youth's current clinical presentation, services the youth is currently receiving, and the response to treatment. Current medications, including medication compliance and our recent medication changes, also including any adverse reaction to previous or current medications. Contact information for the youth's current providers. This information can be provided by the crisis clinician, or the crisis clinician can engage the family to provide this information during the consultation.
Possible follow-up after initial BCBA consultation. It could be that no additional support from the MCPAP ASD-ID is needed. The BCBA will send recommendations directly to the crisis clinician. The BCBA may recommend an additional telehealth visit. The crisis clinician is then instructed to contact the MCPAP ASD-ID coordinator to schedule the visit. If a physician consultation is needed, the crisis clinician is also instructed to contact the program coordinator to schedule. For MD consultations and in other cases, please obtain either verbal or written consent from the youth's family or guardian.
After the consultation, you may receive an email from MCPAP for ASD-ID with a brief satisfaction survey included. If possible, please complete the survey. Your feedback is very important to us. Anytime a youth is in crisis in the future, MCPAP for ASD-ID services can be utilized.
Obtaining consent. When you see a youth with ASD-ID, please discuss with the family or guardian that you may call MCPAP for ASD-ID to get additional expert input. This should allow you to feel comfortable providing the youth's name so that we can bring up information on them from previous calls. If a telehealth visit is going to be scheduled, the BCBA or physician will ask for verbal consent from the family at the beginning of the visit. For youth in residential programs, If this is an emergency, no consent is needed. For subacute crises, the residential program should get consent from the youth's parents or guardian in accordance with their own policies. Best practices in using MCPAP for ASD-ID. MCPAP for ASD-ID can help build clinical competency in caring for ASD and ID youth with young adults up to age 26. Consultations on all ASD-ID youth can be beneficial, even if the youth will require acute level of care. A consultation provides an opportunity to bounce your questions off of someone with ABA expertise and validate your ideas on management or disposition. Communication is key. Please be sure to provide accurate information on how you can be reached. Consultations that include the youth and family are often the most productive.
So the training series for clinicians. The introduction to MCPAP for ASD-ID for CBHC, MCI, and ED clinicians is the one that you just completed, so congratulations. Additional trainings that we do offer to your team and staff are as followed. Questions that you will be asked during a consultation and how they relate to ABA. An overview of ASD-ID. De-escalation strategies for working with youth with ASD. Psychiatric issues and medical issues that can contribute to behavioral changes in youth with ASD or ID. And why so many meds? Understanding psychopharmacology in ASD. And last, supporting emotional regulation, language and sensory processing considerations. And here is the link to our MCPAP trainings if you should be interested in any of them. And we just wanted to end by saying thank you. Here is our contact information for Shelby and I. If you have any questions, concerns, or even if you feel that any of your staff need additional training, please outreach to us and we would happily help. Shelby, did we cover everything?
I think we did. Thank you so much for your time. Have a great day, everyone.